Before implant dentistry was around, we used to often replace a missing tooth with either a removable partial denture or a bridge. Downsides to removable partial denture is that it's removable, for one, and patients do not like that. Secondly, it was attached to other teeth, so food used to trap underneath them regularly, which is annoying to patients, and it impedes their home care, which then basically leads to a lot of decay and other problems developing. As far as other options, there's a fixed bridge, which is basically we shave down a tooth on each side of a missing tooth. The missing tooth is anchored off of the two crowns on the adjacent teeth. The downside there is that since it's anchored to other teeth, if anything happens to any of the teeth involved, the entire bridge fails. Secondly, it's very hard to clean underneath there, so a lot of patients end up with decay underneath those. Also, it puts more strain on the teeth that are supporting the bridge, so some teeth can't withstand that strain, so over time they weaken and they start to break down. So then we have implant dentistry, which is great because it basically allows us to keep a tooth that's a separate entity, so if something happens to the teeth around it, it's not affected. The other benefit of implant dentistry is that the implant goes into the bone, so it basically helps restore that bone and strengthen it. So over time, with a bridge or with a removable partial denture, a patient loses bone structure around the tooth where the tooth was, whereas with an implant, it restores that bone to preserve it and allows you to keep your tooth strong.